Hi again. Once again, my name's Mike, and this speech, present for this speech is Joe, Billy, Brenda, and Debbie. And this speech is a little about what they call the silent killer, or high blood pressure, and how do you beat it. Well, to start, I personally, over the last decade or so, have done about thousands of hours of research and study on this subject. It does run in my family as well as affect other people that I know and love. Okay, so to start, we're going to look at some of the symptoms of high blood pressure. Unfortunately, it's called the silent killer because it doesn't have many symptoms, and if it does, they're going to be quite mild. Usually it might be something like headache, dizziness, a little blurred vision, or a little nausea. You also might find yourself irritated with some other people or a little depressed when you know you shouldn't be. That's really about it. If you miss those symptoms or you don't experience those symptoms, then unfortunately what comes next is a little more severe. And that's where you're in the danger of some things like heart attacks, strokes, aneurysms, kidney failure. You might even have eye damage and blindness. So what can you do about this? Well, to start, monitor your blood pressure daily. You can buy a personal blood pressure monitor for about $20 at any drugstore, and they work pretty well, and they're going to give you a good idea of where you're at. If you do have high blood pressure, the first treatment is going to be drugs. The Mayo Clinic recommends the first class of drugs for almost everybody in every situation, which is going to be a basic diuretic. What a diuretic is going to do is it's going to flush excess water and sodium out of your blood and out of your body, which under theory is going to give your heart less to pump and less pressure so that your blood pressure itself will lower. The next three classes of drugs basically take different routes to doing the same thing, which is they want to relax the blood vessels themselves, which will reduce the pressure. The ACE inhibitors, what those do is they stop a hormone from producing in your body, and that hormone itself will constrict your blood vessels. The beta blockers reduce the nerve signals themselves between your heart and your blood vessels. Now the theory behind that is that if there's less activity, less signals going along, then the vessels themselves have almost kind of a little break. And with that little break, they can relax a little bit and your blood pressure will lower. The calcium channel blockers, they stop calcium itself from entering your heart or your muscle tissue cells. And again, this in theory does a couple of things. Is it gives the heart less to pump itself, and with less calcium in the blood itself, then there's also less likelihood of blockages. Next, we're going to move on to nutrition and what nutrition plays as far as health and blood pressure. The first thing is what not to eat, what not to put into your body. What you want to decrease if you want to lower your blood pressure or keep it low is salt for one. Salt is a big contributor to high blood pressure. You also want less butter or margarine, less of the bad carbs, which are pastas, white rice, potatoes, things like that. You're also going to want less fatty meats and less fast food, and if you smoke, you want to stop. Now onto the good foods. Somebody in the audience didn't like that smoking one. With the good foods, you're going to want to increase your fiber, whether it's through fruits and vegetables or supplementation. Fiber is a good thing for, again, flushing some excess out of your system, which will lower your pressure. You're also most likely going to want to take some more potassium. There's one exception to this, is if your doctor has you on a diuretic. The diuretics will flush potassium as well as sodium out of your body, and he may already have you on a potassium supplementation. So if that occurs, then you don't want to increase that naturally. You're also going to want to eat more high protein and low fat meats, such as skinless, boneless chicken or turkey. And you're going to want to eat some fish and other things like that. And with those, you also get the benefits of omega-3s. The good thing about omega-3s is they're great for your blood, not just the blood pressure itself, but they're like a blood cleanser, and so they'll do many benefits. And the Cleveland Clinic itself has done quite a few studies on omega-3s as well as some other spices and herbs, and they found that omega-3s in garlic are very beneficial to your blood pressure. The University of Michigan has also done quite a few studies, and they've kind of concentrated a lot of these studies on herbs and spices. The herbs that they came away with thinking is very beneficial are almost all of your green herbs. Things like your basil, your oregano, sage, rosemary, parsley. Whether it's fresh or dried, if it's a green herb, it seems to have a blood pressure benefit. The spices that they came away with thinking were very good were garlic and ginger, and cayenne pepper and cinnamon. All of these seem to have a great effect, but cinnamon, even by itself, seems to be exceptional above all the others. In fact, it seems to be so good that you can find the cinnamon pills in every health food store in America today, and a lot of doctors are even recommending cinnamon supplementation. So to finish, if you really want to keep that silent killer at bay, you're going to want to check your blood pressure daily, you're going to want to eat right, and if you do have high blood pressure, then you're going to want to work with your doctor, keep him up to date on your progress, and you should be in good shape. Thanks.